Welcome! Today, we're diving into the world of eczema, also known as atopic dermatitis. This common skin condition affects millions of people worldwide, causing discomfort and impacting daily life. But what exactly is eczema, and how do doctors diagnose it? In this video, we'll break down the basics, explore the symptoms, and walk through the diagnostic process. Whether you're newly diagnosed, supporting someone with eczema, or just curious, you'll find clear answers here. Let's start by understanding what eczema is and why it matters. Eczema, or atopic dermatitis, is a chronic inflammatory skin condition. It's characterized by dry, itchy, and inflamed patches of skin. The word atopic refers to a genetic tendency to develop allergic conditions, while dermatitis simply means skin inflammation. Eczema often appears in childhood but can affect people of any age. The condition can come and go, with flare-ups triggered by various factors. Understanding eczema is the first step toward effective management and relief. The symptoms of eczema can vary from person to person, but some signs are especially common. These include intense itching, redness, dry or scaly skin, and sometimes oozing or crusting. In children, eczema often appears on the face, scalp, and limbs, while adults may notice it on the hands, neck, or inside the elbows and knees. The urge to scratch can be overwhelming, sometimes leading to broken skin and increased risk of infection. Eczema can affect anyone, but it's more common in children and those with a family history of allergies or asthma. Genetics play a significant role, but environmental factors like climate, irritants, and stress can also contribute. Some people may experience eczema only during certain seasons or after exposure to specific triggers. Understanding your risk factors can help in managing and preventing flare-ups. The exact cause of eczema isn't fully understood, but it's believed to result from a combination of genetic and environmental factors. People with eczema often have a weakened skin barrier, making it easier for irritants and allergens to penetrate. This triggers the immune system, leading to inflammation and the classic symptoms of eczema. Common triggers include soaps, detergents, stress, and even certain foods. Allergies are closely linked to eczema. Many people with eczema also have other atopic conditions, such as hay, fever, or asthma. Allergens like pollen, dust mites, and pet dander can trigger or worsen eczema symptoms. Identifying and avoiding these allergens can be a key part of managing the condition. However, not all eczema is allergy-related, and triggers can vary widely. Eczema can sometimes be confused with other skin conditions, such as psoriasis, contact dermatitis, or fungal infections. Each of these has unique features, but overlapping symptoms can make diagnosis tricky. That's why a thorough evaluation by a healthcare professional is essential. They'll look for specific patterns, history, and sometimes use tests to rule out other causes. If you notice persistent itching, redness, or skin changes that don't improve with over-the-counter treatments, it's time to see a doctor. Early diagnosis can help prevent complications and improve quality of life. Doctors can provide guidance on treatment options and help identify potential triggers. Don't hesitate to seek medical advice if you're unsure about your symptoms. During your first visit, the doctor will ask about your symptoms, medical history, and any family history of allergies or skin conditions. They'll also want to know about possible triggers, such as new soaps, detergents, or recent stress. This information helps narrow down the diagnosis and guides further examination. A physical exam is crucial for diagnosing eczema. The doctor will closely inspect your skin, looking for classic signs like redness, dryness, and specific patterns of rash. They may check different parts of your body, as eczema can appear in various locations. The distribution and appearance of lesions help distinguish eczema from other skin issues. Doctors use specific criteria to diagnose eczema. These include the presence of itchy skin, typical appearance and distribution of the rash, and a history of chronic or recurring symptoms. Supporting features, such as a personal or family history of atopic diseases, can strengthen the diagnosis. The process is largely clinical, relying on observation and patient history. Unlike some conditions, there's no single laboratory test that can confirm eczema. Diagnosis is based on a combination of symptoms, physical findings, and medical history. Sometimes, tests are used to rule out other conditions or identify specific triggers, but they're not definitive for eczema itself. In some cases, doctors may recommend patch testing to identify potential allergens that could be triggering eczema. Small amounts of common allergens are applied to the skin, and reactions are monitored over several days. This can help pinpoint substances to avoid, especially if contact dermatitis is suspected. Rarely, a skin biopsy may be performed if the diagnosis is unclear. This involves removing a small sample of skin for examination under a microscope. While not usually necessary for typical cases, a biopsy can help rule out other skin diseases that mimic eczema. Blood tests are not typically used to diagnose eczema, but they may be ordered to check for other conditions or to measure levels of certain antibodies. For example, elevated IgE levels can suggest an atopic tendency, but this is not specific to eczema. Blood tests are mainly supportive, not diagnostic. Doctors must consider other skin conditions that can look similar to eczema. These include psoriasis, seborrheic dermatitis, fungal infections, and scabies. Careful examination and sometimes additional tests help distinguish eczema from these other possibilities, ensuring the right treatment plan. Eczema is especially common in infants and young children. It often appears as red, itchy patches on the cheeks, scalp, and limbs. Pediatricians use similar diagnostic criteria but pay special attention to age-specific patterns. Early intervention can help manage symptoms and prevent complications. While eczema often starts in childhood, it can persist or even begin in adulthood. Adult eczema may appear on the hands, eyelids, or flexural areas like elbows and knees. Diagnosis in adults can be more challenging as other skin conditions become more common with age. A thorough history and examination remain essential. Eczema is a chronic condition, meaning it can last for years or even a lifetime. Flare-ups may come and go, often triggered by stress, weather changes, or exposure to irritants. Understanding the chronic nature of eczema helps set realistic expectations for management and long-term care. People with eczema often experience periods of worsening symptoms, known as flare-ups, followed by times of improvement or remission. Recognizing patterns in flare-ups can help in identifying triggers and planning preventive strategies. Keeping a symptom diary is often recommended. Common triggers for eczema flare-ups include harsh soaps, detergents, stress, sweat, and certain fabrics like wool. Environmental factors such as dry air or sudden temperature changes can also play a role. Identifying and avoiding personal triggers is a key part of managing eczema. Eczema can significantly affect daily activities, sleep, and emotional well-being. Persistent itching and discomfort may lead to sleep disturbances and reduced concentration. The visible nature of the condition can also impact self-esteem and social interactions. Support from healthcare providers and loved ones is important. If not properly managed, eczema can lead to complications such as skin infections, thickened skin, lichenification, and scarring. Scratching increases the risk of bacterial infections, which may require medical treatment. Early intervention and good skincare can help prevent these issues. One of the most important steps in managing eczema is keeping the skin well moisturized. Regular use of emollients helps restore the skin barrier and reduce dryness and itching. Moisturizers should be fragrance-free and applied immediately after bathing to lock in moisture. Topical corticosteroids and other anti-inflammatory creams are commonly prescribed to control eczema flare-ups. These medications help reduce redness, swelling, and itching. It's important to use them as directed by your doctor to avoid side effects and achieve the best results. For moderate to severe eczema, additional treatments may be needed. These can include oral medications, phototherapy, or newer biologic drugs. Treatment plans are tailored to each individual, considering the severity and impact of symptoms. Regular follow-up with a healthcare provider is essential. Simple lifestyle changes can make a big difference in managing eczema. Wearing soft, breathable fabrics, avoiding hot showers, and using gentle skincare products are all helpful. Stress management techniques, such as mindfulness or relaxation exercises, can also reduce flare-ups. Prevention is key in eczema management. Identifying and avoiding triggers, maintaining a regular moisturizing routine, and following your treatment plan can help keep symptoms under control. Early intervention at the first sign of a flare-up can prevent more severe symptoms. While diet is not a primary cause of eczema, some people notice that certain foods can trigger their symptoms. Common culprits include dairy, eggs, and nuts. If you suspect a food trigger, consult your doctor before making significant dietary changes. An elimination diet may be recommended under medical supervision. Stress is a well-known trigger for eczema flare-ups. Incorporating stress management techniques, such as deep breathing, meditation, or yoga, can help reduce the frequency and severity of symptoms. Taking time for self-care is an important part of overall eczema management. Regular follow-up appointments with your healthcare provider are essential for monitoring eczema and adjusting treatment as needed. These visits provide an opportunity to discuss any new symptoms, review your management plan, and ensure optimal skin health. Living with eczema can be challenging, but with the right strategies and support, most people can manage their symptoms effectively. Building a strong relationship with your healthcare team and staying informed about new treatments can make a big difference in your quality of life. Support from family, friends, and patient organizations can provide emotional comfort and practical advice. Connecting with others who have eczema can help you feel less alone and offer valuable tips for daily management. Don't hesitate to reach out for help when needed. The impact of eczema isn't just physical. Chronic skin conditions can take a toll on mental health, leading to anxiety, depression, or social withdrawal. If you're struggling emotionally, talk to your doctor or a mental health professional. Addressing mental well-being is an important part of comprehensive care. Eczema can affect people of all skin colors, but it may look different depending on skin tone. In darker skin, eczema may appear as dark brown, purple, or gray patches rather than red. Recognizing these differences is important for accurate diagnosis and treatment. Eczema symptoms can change with the seasons. Cold, dry weather often worsens dryness and itching, while hot, humid conditions can increase sweating and irritation. Adjusting your skincare routine to match the season can help minimize flare-ups. Broken skin from scratching can become infected with bacteria, most commonly Staphylococcus aureus. Signs of infection include increased redness, pain, pus, or fever. Prompt medical treatment is necessary to prevent complications and promote healing. Itching and discomfort from eczema can disrupt sleep, especially in children. Poor sleep can worsen symptoms and affect overall health. Establishing a calming bedtime routine and keeping skin moisturized at night can help improve sleep quality. Physical activity is important for overall health, but sweat and friction can sometimes trigger eczema flare-ups. Wearing loose, breathable clothing and showering soon after exercise can help minimize irritation. Choose activities that are comfortable for your skin. Weather changes can have a big impact on eczema. Dry, cold air can strip moisture from the skin, while hot, humid weather can increase sweating and irritation. Using a humidifier in winter and staying cool in summer can help manage symptoms. For adults, eczema can sometimes affect work performance, especially if the hands are involved. Jobs that require frequent hand washing or exposure to irritants can worsen symptoms. Using protective gloves and moisturizing regularly can help protect the skin. Children with eczema may face challenges at school, including discomfort, distraction, or teasing. Teachers and school nurses should be informed about the condition and any necessary accommodations. Open communication can help ensure a supportive environment. Pet dander can be a trigger for some people with eczema. If you suspect your pet is contributing to flare-ups, regular cleaning and limiting direct contact may help. Discuss with your doctor about allergy testing if you're unsure. Traveling with eczema requires extra planning. Pack your preferred skincare products, avoid harsh hotel soaps, and dress appropriately for the climate. Staying hydrated and maintaining your routine can help prevent flare-ups on the go. To wrap up, eczema is a common, chronic skin condition that can be managed with the right approach. Diagnosis is based on clinical evaluation, history, and sometimes supportive tests. Understanding your triggers, maintaining good skincare, and working with your healthcare team are key to living well with eczema. Remember, you're not alone. Support and effective treatments are available.